Doctor explains how seniors should drink water to support blood sugar and diabetes health. It might sound remarkably simple, almost too simple to be true, but the potent tool for managing your blood sugar levels may not be found in a prescription bottle at all. Instead, it resides in something as fundamental and often overlooked as the timing and method of your water consumption. You might be thinking, I've been drinking water my whole life. How could that possibly impact my diabetes? Or perhaps skepticism is your dominant emotion, stemming from a history of trying countless approaches that promised significant results but ultimately fell short. You've likely experimented with supplements that yielded no tangible benefits, adopted diets that felt unsustainable and restrictive, and followed advice that sounded promising but failed to translate into improved blood sugar readings. Please stay with me, because the information I'm about to share has demonstrably made a genuine and measurable difference for hundreds of my patients, individuals who were diligently adhering to all recommended practices, yet continue to struggle. My name is Dr. Williams Thompson, and today I will meticulously guide you through the precise way in which strategic hydration timing can enhance your insulin sensitivity by an impressive margin of up to 40%. I am speaking about real individuals, not theoretical cases pulled from textbooks. I am referring to people in their 60s and 70s who meticulously take their prescribed medications without fail, consistently follow their dietary plans, diligently measure every portion of their food, monitor their blood sugar multiple times a day, and engage in daily walks. Despite all these commendable efforts, their blood sugar levels remain unpredictable. They still experience persistent fatigue, and the anxiety surrounding their A1C results continues to be a significant concern. The frustration I witness in my practice is not only palpable, but also deeply heartbreaking. These are individuals who have been engaged in this difficult battle for years, sometimes even for decades. They have invested in specialized diabetic foods, relinquished the enjoyment of foods they genuinely love, and have faithfully followed every directive from their healthcare providers. And they are tired. They are exhausted by the constant vigilance required, weary of the feeling of inadequacy, even when their efforts surpass those around them. Through my extensive years of practice, I have come to understand a crucial principle. Sometimes, the most profoundly impactful medical interventions are not the most complex ones. Frequently, it is the fundamental, basic practices that we have completely overlooked that yield the most significant and measurable positive changes. Recent research emerging from prominent medical research institutions has unveiled something truly remarkable. Consistently drinking water at specific times throughout the day can improve insulin sensitivity by as much as 40%. This translates to your body becoming considerably more adept at effectively utilizing the insulin it produces or receives, whether it's your naturally produced insulin or insulin administered through medication. The key is not solely the quantity of water you consume, but crucially, it is about the timing of your water intake, the manner in which you drink it, and any additions you might incorporate. Subtle, strategic adjustments in timing can lead to substantial advancements in blood sugar regulation. Before we delve deeper into the specifics, I am eager to know your location. Please share your country or city in the comments section below. I find immense joy in observing the global reach of this message, and it serves as a powerful reminder that managing blood sugar is a universal challenge we collectively face. It is important to emphasize that this approach is not intended to replace your prescribed medications or to disregard the guidance of your physician. Rather, it is designed to provide your body with essential foundational support, enabling it to function with greater efficiency so that your medications can perform their intended roles more effectively. To begin, let me elucidate what transpires within your body as you age. Understanding these physiological shifts is fundamental to comprehending why these hydration strategies are so impactful. After the age of 60, several significant biological changes occur, making blood sugar management considerably more challenging even when one is diligently following all recommended health practices. Firstly, your cells gradually develop increased resistance to insulin. This means they become less responsive and efficient when insulin attempts to facilitate the entry of glucose into them for energy production. Secondly, your pancreas's capacity to produce insulin diminishes in its efficiency compared to younger years. Consequently, you are essentially operating with a reduced circulating level of this absolutely vital hormone. Thirdly, your kidneys become less effective at filtering glucose, which results in excess sugar remaining in your bloodstream for extended periods rather than being efficiently eliminated. And here is a critical detail that many individuals, including a surprising number of healthcare professionals, often overlook. Your brain's mechanism for detecting thirst becomes significantly less sensitive as you age. This last point is of paramount importance. You can experience substantial dehydration, even to a dangerous degree, without perceiving any sensation of thirst. Your mouth might not feel dry, and you may not experience any apparent discomfort. However, at the cellular level within your body, detrimental processes are occurring. Even mild dehydration, a mere 2% reduction from optimal hydration levels, which is often imperceptible to you subjectively, can elevate your blood sugar by 10 to 15 points. This increase is substantial enough to transition your blood sugar control from a favorable range to a suboptimal one. It is precisely this level of subtle dehydration that can account for those perplexing morning blood sugar spikes or unexpected afternoon highs that appear to arise without any discernible cause. Allow me to introduce you to Gerald, a patient of mine. He was 68 years old, and even before he settled into his chair in my office, I could discern the profound frustration etched across his face. "Dr. Thompson," he began, his voice strained with emotion, "I simply do not comprehend what I am doing wrong. I am eating with meticulous care, measuring every morsel. I take my metformin precisely as prescribed. I dedicate myself to a 3-mile walk every single morning. I have completely eliminated sugar and refined white bread from my diet. I have implemented every single piece of advice you and my other physicians have given me." He then produced a small notebook, filled cover to cover with his blood sugar readings. "Look," he implored, "some mornings it registers 145, other mornings it's 185. Yesterday morning it was 162. This morning it read 178. And I consume the same breakfast every single day, the same serving of steel-cut oatmeal, the same precise portion." Yet his numbers fluctuated wildly. His wife, seated beside him, added softly, "He tries so incredibly hard, but his A1C continues to creep upward from 7.1 to 7.9 over the past year." We systematically reviewed his entire daily regimen. His dietary intake was excellent, his medication timing was impeccable, and his exercise routine was completely consistent. By all objective measures, everything appeared to be absolutely correct. It was then that I posed a question that seemed almost trivial in its simplicity. "Gerald," I inquired, "walk me through your morning routine from the moment you wake up until you have your breakfast." He responded, "I typically wake up around 6:30 a.m. I check my blood sugar immediately upon waking. Then I make my coffee and drink my coffee while I read the news on my tablet. Around 7:30 a.m., I prepare my oatmeal and take my medication with a glass of water. I then ask the pivotal question, 'When do you drink plain water?'" He paused, genuinely perplexed. "When I feel thirsty, I suppose, sometimes with my medication pills. Is that incorrect?" And there it was. Gerald was going from 6:30 a.m. until 7:30 a.m., or even later, before consuming any actual water. This meant 8 full hours of sleep without any fluid intake, followed by another hour while awake without any hydration. This amounted to a cumulative period of 9 hours of progressive dehydration. We implemented simple yet strategic changes to his routine. Every single morning before he consumed his coffee, he was instructed to drink a glass of warm water with a very small pinch of natural sea salt and the juice of half a fresh lemon. He was also advised to drink a glass of room temperature water 15 minutes before both lunch, and dinner. Furthermore, he was encouraged to carry a reusable water bottle and to sip water consistently throughout the day. 2 weeks later, he called my office. His voice was transformed, lighter, and tinged with unmistakable excitement. My morning readings have consistently been between 125 and 138 for the past week, he reported, every single day. This level of consistency has not occurred in over 2 years. By the following month, his average fasting glucose had decreased by a remarkable 22 points. This improvement was achieved with absolutely no changes to his medication. It was solely the result of strategically timed water consumption. I honestly thought you were a bit crazy, he admitted with a genuine smile during his follow-up appointment. Water seemed far too simple to have any real effect, but I cannot dispute the readings on my glucose meter. The numbers simply do not lie. Before I unveil the precise method that has empowered my patients to achieve these remarkable outcomes, allow me to outline the 3 most prevalent hydration mistakes I consistently observe in my practice. It is highly probable that you are currently making at least one of these errors. Mistake number 1. Delaying hydration until you experience thirst. Thirst is not an early indicator of your body's fluid needs. Rather, it is an alarm that sounds only after you have already become significantly dehydrated. By the time your mouth feels genuinely parched, your blood has already begun to thicken, your glucose levels have already started to rise, and your insulin is already struggling to function optimally. Visualize your blood as a river carrying glucose to all your body's cells. When this river is full and flowing smoothly, glucose is efficiently transported to its intended destinations. However, when the river's volume diminishes, it becomes sluggish, thick, and slow-moving. Glucose then becomes impeded, accumulating in your bloodstream instead of reaching the cells that desperately require it for energy. Mistake number 2. Consuming large volumes of water all at once. Some individuals go for extended periods without drinking any water, only to then consume a substantial quantity in an attempt to rapidly rehydrate. However, your body can only effectively absorb approximately 200 to 250 milliliters, about 1 cup, of water every 15 minutes. Any volume exceeding this amount will simply pass through your system and be eliminated via your bladder without actually hydrating your cells. This is akin to watering a houseplant. If you were to pour an entire bucket of water onto it all at once, the majority of the water would run off the sides, leaving the roots inadequately hydrated. Conversely, if you water slowly and consistently over time, the soil gradually absorbs the moisture, ensuring the roots receive the nourishment they require. Mistake number 3. Drinking ice-cold water, particularly first thing in the morning or immediately before meals. While the sensation of cold water can be incredibly refreshing, especially on a warm day, ice-cold water causes your blood vessels to constrict and narrow. When your blood vessels constrict, it becomes significantly more difficult for insulin to reach the cells that are in urgent need of it. Water at room temperature or slightly warm temperature helps to keep your blood vessels naturally relaxed and dilated, thereby facilitating more efficient circulation and action of insulin. This is especially critical in the morning and around meal times, when your body is actively processing glucose. Now, I will introduce you to the specific method I employ with my patients, which I refer to as the H3 method. The H stands for hydration, and the 3 H's represent 3 crucial timing points throughout your day, as well as 3 essential elements that contribute to the efficacy of this approach. Let us begin with the timing points. Timing point number 1, first thing in the morning. This is arguably the single most important timing point of your entire day. The moment you wake up, before you have your coffee, before you eat breakfast, before you check your phone, or engage in any other activity, drink 1 full glass of warm water, approximately 350 milliliters or about 12 ounces. Here is the crucial addition. Incorporate a tiny pinch of natural sea salt, and I mean genuinely tiny, just enough to fit on the tip of a butter knife, and squeeze in the juice from about half a fresh lemon. Why these specific additions? Following 8 hours of sleep, your body is not only dehydrated from the absence of water, but has also depleted electrolytes through normal nocturnal processes. This small quantity of sea salt provides essential sodium, potassium, and magnesium, which actively assist your cells in absorbing and utilizing the water you are drinking, preventing it from simply passing through. The lemon contributes vitamin C and creates a mild acidity that helps to stabilize your body's blood sugar response to your first meal of the day. This simple morning ritual achieves something quite remarkable. It signals your adrenal glands to calm down. These glands naturally produce cortisol, your stress hormone, which typically peaks in the morning. Cortisol instructs your liver to release stored glucose into your bloodstream. By mitigating this stress response through appropriate hydration and mineral intake, you effectively prevent that unnecessary morning blood sugar surge. Allow me to share the experience of Elizabeth, a 72-year-old patient who had been managing type 2 diabetes for 14 years. Her most persistent source of frustration was her morning blood sugar levels. She would consistently wake up with readings between 165 and 175, despite having consumed a carefully measured dinner and having had acceptable bedtime readings. We initiated a single, fundamental change: warm water with a small pinch of sea salt and fresh lemon juice, consumed first thing every morning, at least 20 minutes before her coffee. After 3 weeks, her average morning blood sugar readings had decreased to 128. Her medication dosage remained the same, as did her evening routine. The sole alteration was how she began each day. "I wake up feeling genuinely different too," she reported during her follow-up appointment. "My mind is clearer and I experience less mental fog and confusion, and that lower morning number provides me with a sense of confidence and momentum that carries me through the entire day." Timing. Point number 2. Before meals. Approximately 15 minutes prior to consuming lunch and dinner, drink a smaller glass of water, about 150 to 200 milliliters, which is roughly 1 cup. This seemingly simple habit triggers a significant physiological response. It prepares your entire digestive system, stimulates the production of enzymes, and most importantly for blood sugar management, it slightly dilutes the contents of your stomach. This dilution directly slows down the rate at which carbohydrates are absorbed into your bloodstream. When carbohydrates enter your bloodstream gradually and steadily rather than in a rapid influx, your available insulin is better equipped to meet the demand. Your blood sugar then rises gently and consistently rather than spiking dramatically. Clinical studies have demonstrated that this remarkably straightforward habit can reduce post-meal blood sugar spikes by up to 20%. Often, this reduction represents the crucial difference between struggling with blood sugar control and maintaining genuinely effective management. Timing. Point number 3. During physical activity. If you engage in walking, gardening, household chores, or any sustained physical activity for more than 20 minutes, it is imperative that you drink water during that activity, not solely afterward when you are already depleted. Aim to consume approximately 100 to 120 milliliters of water every 15 minutes of sustained activity, opting for small, frequent sips rather than large gulps. This consistent hydration helps to maintain stable blood volume and prevents the blood sugar fluctuations that commonly occur with physical exertion, particularly in individuals with diabetes. Now, let us delve into the 3 essential elements of the H3 method. Element number 1. Temperature matters. Water at room temperature or slightly warm is optimal, especially when consumed first thing in the morning and before meals, ideally around 22 to 24 degrees Celsius, approximately 72 to 75 degrees Fahrenheit. While cold water is not inherently detrimental, warm water promotes natural relaxation and dilation of your blood vessels, leading to significantly improved insulin circulation and delivery. This is a seemingly minor difference that accumulates to produce substantial benefits over time. Element number 2, minerals matter. Pure demineralized water alone is not entirely sufficient. Your cells require minerals to effectively absorb and utilize water. That tiny pinch of sea salt incorporated into your morning water provides these essential minerals. Natural sea salt contains sodium, potassium, and magnesium in a balanced proportion. It is important to avoid regular processed table salt, which has been chemically stripped of these vital trace minerals. Opt instead for unrefined sea salt or Himalayan pink salt, which retain the full spectrum of minerals your body truly needs. Element number 3, timing. Consistency is profoundly important. Your body thrives on predictable routines. Consuming water at consistent times each day helps to regulate your entire metabolic system. The morning water should be consumed at the same time each day, and pre-meal water should be taken at regular intervals. This consistency directly contributes to stabilizing blood sugar patterns over time. There is one additional recommendation that I consistently provide to my patients. Approximately 1 hour before bedtime, drink a final glass of warm water with 200 milligrams of magnesium citrate or magnesium glycinate dissolved into it. Magnesium plays a critical role in proper insulin function, and a significant majority of individuals over the age of 60 are clinically deficient in this mineral. Consuming magnesium before sleep offers a dual benefit. It aids in muscle relaxation, promoting deeper and more restorative sleep, and it helps to maintain significantly more stable blood sugar levels throughout the entire night. A question I am frequently asked by patients is, "Doctor, precisely how much water should I be drinking each day?" Here is a simple and practical formula. Take your current body weight in pounds and divide that number by 2. The resulting number, expressed in ounces, represents your baseline daily water intake requirement. For instance, if you weigh 160 pounds, you will need approximately 80 ounces of water daily, which equates to roughly 10 standard cups. If you engage in regular exercise or spend significant time in warm weather, you should add an additional cup of water for every 20 minutes of physical activity or heat exposure. How can you ascertain if you are adequately hydrated? Observe the color of your urine. It should be a pale yellow, similar to lemonade. A completely clear urine may indicate overhydration, while dark yellow or amber urine signals dehydration. Pale yellow is the optimal indicator of proper hydration. For practical implementation, consider acquiring a reusable water bottle that holds approximately 24 ounces. Fill this bottle completely 3 times throughout the day, once in the morning, once at midday, and once in the afternoon. This totals 72 ounces, which is perfectly adequate for most adults. Keep this water bottle constantly visible, on your kitchen counter, your work desk, or in your car. Visual cues are far more effective than relying solely on memory. So, what can you realistically expect to happen as you begin implementing this method? In the initial week, you will likely find yourself needing to use the restroom more frequently. This is entirely normal and expected as your body adjusts to adequate hydration levels. This frequency typically subsides significantly by the second week. You should begin to observe a stabilization of your morning blood sugar levels, perhaps noting an average reduction of 10 to 15 points. This is not an overnight miracle, but rather a consistent and measurable improvement. By weeks 2 to 3, you should experience noticeably more stable energy levels throughout the entire day, with a reduction in the frustrating afternoon energy slump. Your post-meal blood sugar readings should become substantially more predictable and consistent. By the 4th week, if you have your A1C checked, you may observe it beginning to trend downward. While not necessarily a dramatic drop immediately, you should see clear movement in the right direction. And here is what I hear most frequently from my patients. "Doctor, I simply feel genuinely better. I cannot precisely articulate why, but I feel more like my old self again." This is the direct outcome of proper hydration. It does not cure diabetes, nor does it replace necessary medication, but it significantly assists your body in functioning as it was inherently designed to function. Let me be unequivocally clear on a critical point. This hydration strategy is not a substitute for professional medical care. If you are currently taking diabetes medication, do not discontinue it. If your physician has prescribed a specific management plan, continue to follow it diligently. What this hydration method accomplishes is to support your existing medication, making it function considerably more efficiently within your body. I have had patients who, after 3 consistent months of adhering to this protocol, were able to reduce their medication dosages under the careful supervision of their physician. This was not because water replaced medication, but rather because their body's entire metabolic system began to function more optimally. If you have any degree of kidney disease, it is essential to consult directly with your physician before substantially increasing your water intake. For the vast majority of individuals, this approach is entirely safe and highly beneficial. However, if your kidneys are not filtering properly, you will require individualized professional guidance. If you are taking blood pressure medication, you should pay close attention as you increase your hydration. Proper hydration can naturally lead to a reduction in blood pressure, which is genuinely beneficial, but it may necessitate adjustments to your medication dosage. Monitor yourself carefully for any dizziness and report it to your doctor immediately. Let me tell you about Dorothy, who was 74 years old when we first met. Dorothy had been managing her diabetes for 19 years. She was on multiple medications, had followed various restrictive diets, and had attended diabetes education classes at the hospital. She understood carbohydrate counting with a level of expertise that surpassed that of many registered dietitians. However, her A1C had been on a steady upward trajectory, reaching 8.6%, and her endocrinologist was seriously considering initiating insulin therapy. "I feel like I have completely failed," she confided quietly, her voice wavering slightly. "I have done absolutely everything right for 19 years, but my body just seems to be getting worse and worse. Perhaps this is simply an inevitable progression. Maybe I can no longer fight it." Her hydration habits were, to put it mildly, suboptimal. She might consume perhaps 3 or 4 small glasses of water daily, if that. She would drink coffee in the morning and tea in the afternoon, but very little actual plain water. "I never feel thirsty," she explained. "And honestly, I dislike constantly having to use the bathroom. It's rather embarrassing when I'm out with friends." We commenced the H3 method together. Yes, for the initial week or so, she did experience more frequent bathroom visits, but I reassured her that her body would adapt within approximately 10 to 14 days. 6. Weeks later, she walked into my office appearing noticeably younger. Her eyes were brighter, her skin looked healthier, and she was genuinely smiling. "My numbers have been the absolute best they've been in 5 years," she declared proudly, showing me her glucose log. "My average used to hover around 185 to 205. Now I am consistently in the 145 to 165 range. My doctor has even reduced one of my medications." But she emphasized that it wasn't solely about the numbers on her meter. "I have genuine energy again," she exclaimed. "Real, sustained energy. I can think clearly without that constant mental fog. I have even started gardening again, something I had completely given up on 2 years ago." 3 months later, her A1C results returned at 7.3%, a significant improvement from 8.6%. "You have given me my life back," she said, tears streaming down her face, but they were tears of joy. She reflected, "All this from water, something that costs virtually nothing. I just wish someone had explained this to me 19 years ago when I was first diagnosed." Dorothy's story is precisely why I dedicate myself to creating these educational videos. There are countless thousands of individuals precisely like her, struggling intensely at this very moment, feeling utterly defeated, when often the solution is genuinely simpler than anyone could possibly imagine. I want to personally challenge you to try this approach for a period of 14 days, just 2 weeks. Adhere strictly to the H3 method, as I have meticulously outlined it. Morning water with sea salt and lemon first thing upon waking. Water 15 minutes before lunch and dinner. Adequate daily water intake consistently spread throughout the day, and magnesium water before bed. Diligently track your blood sugar during those 2 weeks. Observe for yourself if the numbers begin to improve. Pay genuine attention to how you feel. Increased sustained energy, clearer thinking, and enhanced sleep quality. If, after 2 weeks, you observe tangible improvements, continue with the practice. Make it your permanent new normal, and please leave a comment detailing your observations. Your personal story could be precisely the encouragement another person desperately needs to give this method a serious try. If you have reached the end of this video, please type "I watched till the end" in the comments below. This genuinely helps me understand that this message is reaching individuals who truly need it, and it assists YouTube in sharing this vital information with more people who are grappling with blood sugar management. Furthermore, please tell me, are you going to try the H3 method? What is your biggest challenge in maintaining adequate hydration? Share your thoughts and insights in the comments. I read every single message. If you found this information to be genuinely helpful, please consider sharing it with someone who is struggling with their blood sugar, be it a parent, a spouse, or a close friend, who could significantly benefit from this simple, practical strategy. And if you have not already done so, please hit that subscribe button and activate notifications so that you never miss future videos focused on diabetes management, improving metabolic health, and living well with chronic conditions. Thank you for being here and for taking your health seriously. Remember, small strategic changes implemented consistently lead to genuinely measurable results over time. Take care of yourself. This is Dr. Williams Thompson.